I got 2 of the buttons, but not all 3 of them, but now we've got all 3 buttons, so we're ready to go. So good afternoon, everybody. Welcome aboard, and welcome to our Stand Against Racism bonus webinar for our National Campaign for Stand Against Racism, really looking at racism as a public health crisis and how we translate data into policy. So again, thank you to all of you kind of out there in the universe, out on Facebook who are watching here live and also on the replay as well. We're really glad to have you join us in this really important conversation. So Stand Against Racism is a long-standing tradition here at YWCA Greater Green Bay and also YWCAs across the country. And this week we join in with more than 200 of our local associations across the country to focus on a singular topic for a couple of days to really bring some light to it. And this year our theme is addressing racism as a public health crisis. So if you want some more background information on this, if you are watching this webinar and it's really fascinating and you want to know some more, we did do a webinar earlier today that's up on Facebook and it'll be live on our webpage soon about really kind of doing some level setting about why it is we're even talking about these two things at the same time, like what does this happen here? And then we've also done a Stand Against Racism webinar series over the course of the last year, where we've really focused on a lot of the social determinants of health and a lot of different kinds of perspectives on the COVID-19 crisis coming from different cultural communities. So there's a lot of really good work out there already. So if you're watching this one and are really fascinated and want to know some more, we've got some other pieces out there as well for you to dig into. So I would encourage you to do that. So getting started today, I want to be so very, very thankful of our panelists today in joining us. And we've got a really like stellar crew here on a Friday afternoon. I feel like it's a little bit of like happy hour time with the girls. I like it. So first we've got Natalie Baumstead from Wello. Natalie, thank you so much for being here with us.
Thank you for having me. So nice to be here with all of you. My name is Natalie Baumstead. I am the Executive Director of Wello. At Wello, our mission is to co-create community conditions that are fair and just to drive high levels of health and well-being for all. So right in our mission statement, it really is about those fair and just community conditions. So when we think about racism as a public health crisis, it really is essential that we are willing to name, discuss, and take action around the systemic barriers that racism creates in our community. An inability to address these things is really an inability to address health and well-being in our community. So very excited to be here today and to be with these other wonderful panelists.
Next, we have Amanda Chu, who is a Brown County Board of Representative on the Brown County Board. There's a title in there somewhere.
It's all of the above, I think, but we're called supervisors. So I'm a supervisor on the Brown County Board. Yeah, so I'm serving in my first term and have gotten to work with the wonderful panelists here and a lot of other folks in the community. So I'm looking forward to contributing to the discussion around this, from what we've been able to do on the county board. So thanks.
And Amanda was such a champion in getting the Brown County Board to declare racism as a public health crisis. And really part of the reason why we specifically asked you to be here today was because of that work that's being done here locally and how we're sort of continuing to move forward from that then. And last but certainly not least, we have Representative Christina Shelton. Hi, Christina.
Thank you for having me here today. I know I was kind of thinking too, can we bring drinks? Probably not yet, probably after this, but this is great. Thanks for putting this together. It's wonderful to be amongst friends and colleagues doing fantastic work. I have the honor of serving the 90th Assembly District in the state legislature, which is essentially the city of Green Bay. Before that work, I was the vice president on the Green Bay School Board, and I'm an educator by trade. But my background is in community organizing and community health, which is, this conversation is perfect for me because this is essentially why I got involved in politics, was seeing the data, seeing where the decisions were being made, and then deciding that I wanted to be at that table at the highest level where I could really take the data and the research and into the policy. So I'm excited to have this conversation today with all of you. Thank you.
So where we'll get started today is really the question of where is it that we're getting this data from? How are we collecting data locally and regionally? What are the kinds of things that we're looking at? And what are the kinds of things that we're finding in our data locally?
I feel like Natalie should start that conversation.
I didn't know if you were unmuted because you wanted to jump in. I can certainly jump in there. So at Wello, one of the things, one of kind of our key, I guess, deliverables you would call it, or kind of the key pieces of our work is around really measuring the health and well-being of all Brown County residents. And we have really a three-pronged approach to how we do that. So the first is a biannual resident survey that goes out to all of Brown County, and it's based off of the World Health Organization Quality of Life Brief Survey. So that's a validated instrument that's been used around the world to really assess the subjective measure or how people are actually feeling about their lives. So we know that we have a lot of objective indicators, but often you can think about, you know, if you have an objective indicator that says something about someone's physical health, say a BMI, right, a blood pressure. Well, what that doesn't tell us are kind of the context around that number. And so we really saw that there was a gap in kind of really having that contextual and that subjective measure, which is why the survey was established. 2021 will be the second year that we'll be collecting that data. And so we're really excited to be able to have kind of a pre-pandemic measure as well as a post-pandemic measure of that. The second piece of that measurement kind of overall project is a longitudinal panel study. So that is a group of Brown County residents that will be tracking over time and asking questions to around their health and well-being and seeing, you know, how certain interventions or different things that are happening in the community can impact a person's well-being. And the third piece of that is really around ground truthing efforts. And I think that's the piece of data that oftentimes is kind of overlooked, or we may not put as much value on that. But in particular, I feel like when you're thinking about how you develop policy, how you develop programs and interventions, we really need to understand how people feel about their lives and incorporate that lived experience into the way in which policy decisions are made, in terms of how priorities are set, who's making those priorities, are we doing that together as a community and truly kind of co-creating, or, you know, is someone in a room in a faraway place making those decisions for us? So taken together, kind of Wellow's approach has really been that three-pronged approach, really feeling as though together, each one individually may have its pitfalls, but taken together, we can have kind of a cohesive view of what well-being looks like in the community. You know, in that first round of data collection efforts in 2019, what we did find is that communities of color in Brown County, and across the board, the well-being scores were lower than our Caucasian residents, right? So there really is, I think, from a data standpoint, and that subjective data standpoint, real reason to kind of say, what's going on here? How can we do better? How can we learn more? And I think it really pointed to some specific issues in which the declaration really kind of came out of as well.
You know, Natalie, what I love about the work that you're doing at Wello is that you're looking at trends, state, federal, you know, nationally, but you're really focusing on that story of what's happening here in our community. And I love that you're taking that deep dive. And what I think is so interesting about data is you think about the many different institutions and organizations that are gathering data, using it to use, as you said, drive priorities. And to me, that's really where the emphasis needs to go, is how do we coordinate that better from the federal, state, and local side? You know, you think about school districts collecting, public health departments, state level institutions, federal initiatives like the youth risk surveillance, behavior surveillance system that's collecting data. And to me, what I look at when I'm thinking about when I'm putting my policy hat on is, you know, what exists, what is the story that this is telling, and then how can I interpret that to determine what actions we're going to take to close gaps or to look at inequities, to look at disparities And then to turn around too and look at best practice and say, what does the science also tell me what works here? So I love that that's the approach that you're taking with that.
Thank you.
I also want to highlight that YWCA and Brown County Health Department did some work this year to really gather some qualitative data to go along with the community health assessment, community health improvement plan process. That really is a mouthful to the SHA chip thing. But such a important piece of work, and really, like, we were so excited to be included in that process, and to be able to see kind of behind the scenes how the Brown County Health Department is really engaging with data and collecting data and that sort of piece of things. It was very humanizing for us, I think, to be able to realize that we're talking about like real people with really good intentions who are putting together this work and doing really to the best of their ability to gather this data and be really honorable and respectful in the way that they're doing that. So it was a really cool and interesting experience for us, for sure.
That's so great to hear. I've in this past year like learned about that whole assessment process, and gotten reports and seen presentations on it from our public health team, and I've been so impressed to see what the evolution has been, the cultural evolution has been like within that public health department, for them to take the initiative and be thinking a little bit more broadly about how there are other really critical partnerships that they hadn't worked to create yet, to bring in that full set of data, like whether it's objective or subjective. So we get the full context like Natalie's talking about. So, I mean, some of that work, that chip work is going to go into, and we'll get into it later too, but it's a great starting place, like what Wello's come up with the public health department, CHIP has come up with community partners for the racial equity committee to begin working through and kind of see where it points, which direction it points for all of us. So there's so much critical work that can't happen unless we have these incredible data gatherers and aggregators, and that data is only as rich and full as the people making the connections to make the ask. So all of that took so much relational development to get significant data and make those asks, and just to continue to applaud the work of Wello. That's something that Wello has been so intentional about, and quite frankly YWCA too. So two incredible partners represented right here in our community around racial justice, social justice, and in seeking equity. So thank you.
So speaking of the data, what are some of those pieces that are really coming out? Natalie, you mentioned this, that in your original data, you saw that there was this disparity here. As we continue to really dig into that data, what is it that we're finding, where those gaps are, what the disparities are? What is that data telling us?
Absolutely. So from purely a kind of a Wello perspective in that data set that we're talking about, there were two kind of areas in particular. There were one around social relationships as it relates really to feelings of inclusion and belonging in the community, as well as our environments as a whole. So you can think about, where in our community people live, and that built environment, that kind of the man-made, we say, environment that we all live, work, and play and pray in. Those were two areas where we saw a larger gap between kind of communities of color and our white community members in the Wello data set in particular. And so I think, in terms of what have we done with that so far, it's been interesting because I think our region is really good at collaborating, right? So Northeast Wisconsin as a region, thinking about Brown County and down to the Fox Valley and even into like Winnebago County, the social relationships in terms of inclusion, sense of belonging has been something that has been found across our whole region. And so we have gotten together regionally with partners to say, okay, so we know that there's been data collection efforts at a regional level that have all pointed to this, and in particular that there's a huge disparity in who is feeling this, right? And so how can we maximize our resources and capacity to truly change what this looks like? Really create those community conditions that allow everyone to thrive, right? How can we remove barriers to do that? And it's interesting when you talk about things such as inclusion and sense of belonging. In many ways, it's about building relationships and trust, right? And it's showing up and being willing to listen. And so I know that those have been some intentional efforts that have happened not only here in Brown County, but at a regional level to say, first, okay, the data is pointing very clearly that we have a problem, we have an issue here. And so how are we going to come together to really address that in a way that is comprehensive, but also not just from a top-down mentality, but how are we truly building this from the ground up and working with our partners to do that in this co-create type mindset process.
I am very new to the Green Bay area, and when I kind of first was offered this job, maybe this was the thing I was going to do, I dove into some stuff and was like, what is this community that I would be potentially joining? Like, what's going on here? And one of the things that stuck out to me so much in that was, I think it's in the life study, and it's this piece that more than half of respondents said that increasing diversity was a bad thing, that there was a problem here with increasing diversity. And that was so very shocking to me to see that we have this kind of community perception. And I don't know what's sort of driving that answer. I don't know what's going on there, but there's clear, like in my brain at least, like that's clearly a problem.
I'm glad you brought that up because I was thinking that too. And one of the things that I see is, of course, there's always gaps and additional data points that we need to understand more, right? And we need to dive deeper into. But what I see is, generations and years where we've seen similar trends in our data, where we know issues exist and we know that there are significant disparities. I mean, let's get real. Wisconsin is regrettably one of the worst states in terms of racial equality. We've known that for years. And so the question is, when are we going to have the will and the courage to look at the data for what it is? And instead of pinning it on individual choices, understand that these are systemic policy-driven issues that we have chosen to make. Policy is a decision that we choose. And so, as simple as it might sound, we can choose different policy and we can choose different legislation that closes gaps. Kendi talks about how there's no race neutral policy. Policies and legislation either create inequities and disparities or they close gaps. And so I would challenge us as leaders to say, for many of the issues that I think we are facing, we have the data to show, one, what the issues are and where the priorities should be. And two, there's significant research to show what the best practices are to start to dismantle those oppressive systems and to lift people up and to close, move from the margins in. So that's to me the biggest gap. The other thing that comes to mind as well with data collection is we need more people from community getting involved in what this even looks like. I mean, there's communities, especially within our Black communities, that are significantly hesitant and careful to not share about what's happening in their community for good reason. And that's a significant barrier to understanding and working with communities because, within white culture, there's a history of white folks showing up in communities and saying, we're here to help, let me show you the way. And that white savior sort of mentality has been very destructive for many communities.
So how do we use this data? Christina, you were talking about the importance of that in decision making and setting priorities. So how do we really use this data and translate that into initiatives and priorities and where it is that we're going to go with this? What are we going to do about it?
So is that back to me? I think for me, in my work, in the community, on the school board, and in the state legislature, there's a recognition for all of us, what we all do, right? That there's a limited amount of time that we have within our day to really focus our energy on the most critical work ahead. And I think that's where data comes into play. I mean, we're able to look at what is in front of us, but also to balance that with what we're hearing from our constituents and our neighbors and our friends and family. Up here, what I hear a lot about, and I'm excited to have Amanda talk about her work on the county board, but issues like alcohol use, PFAS contamination in water, incarceration rates, significant disparities in economic security. So I try to think about the social determinants of health, but think about that from an infrastructure sort of institutional lens. Because if I can identify an issue, and then we can work with community to identify best practice and a fix, if you will, then we can start to mobilize around specific issues. But I think because Wisconsin has so far to go in closing disparities, it can at times feel like drinking out of a fire hose, right? How do you eat an elephant? But that's where priorities have to be set, because it can feel really overwhelming at times, especially if for smaller institutions, like the YW or Wello, Natalie, you have a handful of staff. Imagine what you could do if you had 20 people working on your staff. So definitely barriers there.
A way that I've seen data translating into the policy is, moving forward to have these companion resolutions, one that acknowledges racism as a public health crisis and commits the county to doing some internal institutional level work within, and then also commits the county board of supervisors specifically to be working in community to begin to address the issue from that body. But there are departments like the Public Health Department, the ADRC, the Neville Public Museum. There are already departments that are housed within or adjacent to the county that have already taken next level steps and engaged in deeper level work to think about how they can be a part of creating racial equity and like changing their internal systems, whatever they have like within their control. So this is what we did as a board of supervisors, was from that perspective. So this commits the board of supervisors to be really engaged internally and in community. And so the second resolution created a racial equity ad hoc committee to develop an action plan, which is so broad and open, to begin thinking about and like create a vision for next steps, like tangible next steps that the county board of supervisors can be taking. But none of that, like all of the work, the one-on-one conversations, the public comment, the really organized way that Wello was able to like come in from the outside. They've already developed relationships and they were able to mobilize individuals and big like businesses, entities, other big major institutions in the county to come and say like, this is valuable to say. These are not just words, because that was some of the early pushback that we got. And we know that because of this. And then there's like the data spills out. And so if not for the meaningful data bites, I don't know that we would have been able to pass those two resolutions. So it was like fundamental to having an elevated discussion that was hard and challenging in the one-on-one and in the committee and at the board level, but it passed. And a lot to do because one of the organized approach that Wello was like key to creating to get the public comment there and let them know that let all of us know as supervisors, like public perception is this. Also, all of the data says this. The American Medical Association says this. Like this is, it already exists. This is just your very small way to take that next step. And if not for all of that data gathering, it wouldn't have been possible for us on the board.
The other thing I would just add to both of those comments is that in many ways, sometimes we find in Brown County and Wisconsin, we're in a data desert, right? So when we're talking about systemic racism, you can imagine that this isn't something that we have a ton of data a lot of times around, right? And so, we're really seeing a push across the country to establish more structures and systems to actually measure this, because a lot of times when you go to policymakers and they're say, well, what does the data say? If you say you don't have the data, right? Well, what does that mean? Why don't we have the data, right? It may not be that the data, says X, Y, or Z. It is maybe like we don't have that data. So it's so important that that data component and that local data component is part of this process to really dismantle structural and systematic racism. We need to have processes to collect that as well, because I think in the absence of that, maybe the conversation goes, well, maybe there's not a problem, right? And we know there is. So I think, we often see that in many areas of different social determinants of health, that there just may be a gap in actually having local data as well.
And Natalie, I love that too, because what I'm hearing from you and Amanda is the data is important, but the data alone doesn't move things forward, right? You have to organize, you have to speak from the heart, you have to tap into the humanity of there's all those other mechanisms, right? I mean, you think about, the racial justice task force that the governor, I think that's what the title was, the governor put forward last year after, or the legislature did after Jacob Blake. And what I heard from a lot of Black community members was why are we having another task force? We already know what needs to happen. And so there is that like push pull of, there are times where more data is needed, but also we sometimes and often and historically have used that to also limit progress, to say, well, but we need more, when in actuality, we have a lot of information at our hands. I'm wondering if either of you have any thoughts about that.
I heard that. I heard, but like in the process of getting these resolutions passed and creating this committee, heard both of that. And like, it's easy for folks to kind of talk out of both sides of their mouth if they're just not willing to even consider thinking about systemic racism, and they have never even said those two words together. I mean, that's kind of the level that some of the decision makers are at. And so moving very slowly, very painfully, like getting to the point where we're like putting the vocabulary out there, and then from that point, because there's an unwillingness to even consider the fullest meaning of systemic racism and that connection between racism being a public health crisis, that tension, that push pull of that, Christina, was exactly, the excuse that was used. Like, well, this looks like it's statewide data. Do we have anything that's specific to Brown County? And then like ... and not like filling in the gaps or like really investigating further or leaving anything constructive on the table to like move from, or, someone using their own anecdotal experience that is not representative of the experiences of folks of color to just like pivot the entire focus away from what we're really talking about, these systems and the foundational racism that's just been persistent for so long. So though, just talking about the excuses, the reasons why we don't want to look at the thing that's really hard to look at is really interesting. And data was one of those like red herrings to kind of distract the fundamental core discussion that we were trying to have.
And just to build upon that, when you're organizing or getting people to the table, as Amanda was talking about, we're working with institutions, activists, community members, that stall tactic is really frustrating to work through, right? I would get calls and people would be like, well, they wanted a bunch of data, and now the data's not enough. Why aren't people believing me? Why won't people believe my experience? We had the courage to come and talk, and we felt like we weren't heard, right? And so Completely agree. I think it's really difficult, and I think in particular for our community, why it was so important for this declaration to pass at the county level, within the city. We have about 20 organizations now, all 3 health systems who have signed on to this. It's just a really important step to say the thing, to say racism, because we have to understand where our community was starting from in terms of how are we going to create change if we're not even willing to say it, right? And so in some ways we got pushback about, well, it's just a declaration, it's just words on paper. It's like, well, if we're not even willing to do that step, how are we going to have these courageous and very vulnerable conversations down the road to address this? And so I do think it was really essential for this process to unfold, and even to see how there are more and more people who are now willing to, racism, and really like self-reflect on what that means, and what that means for their organization or just their personally. And so I think it was a very important step for our community, and part of that community work is understanding where the community is starting from. So you're not starting, everyone's on a different part of this journey, right? However, it's like really establishing what is the shared value. We need to say these words. They are really important to say so that we can take that really intentional action together.
And really what it is it's white supremacy shape shifting to maintain power. That's what that is, right? It's well, this, or no, it's this, or, and I'm sure you both have heard this too, when you start to talk about systemic issues, and we start to reduce it to the individual. Well, I know so-and-so and they're a good person. Well, I'm not talking about this specific person. I'm talking about a system of X, right? And it's interesting, as I've gotten better at identifying the coping mechanisms that essentially white culture uses to keep power. It's helped me in my own space, right, as a white woman, to reflect when I'm doing it, and then also to help to identify when others are doing it in those spaces where we're having, because it's, it is about race, but it's about ableism, it's about, it's about all the different, sexism, it's about, transphobia. So it cross cuts, and it's a skill that I am building. But what excites me is it's a skill that I see our young people really doing very well. They have the no bull, crap filter. Like they get it. And to me, that's what is exciting, is to see that like generation coming up, holding us accountable, modeling that language, and like calling it out for what it is. Because you're right, Natalie, like how can we work on something that we don't even have the courage to name? You're muted, Andrea.
So we have a question from a participant here, wondering about this piece of using one's own experience to pivot a conversation into a different direction. And what does that sort of look like so that we can help to identify that, maybe recognize if we're doing it, or recognize when our friends or family are doing it, somebody that we would maybe be comfortable being able to call out for that kind of behavior.
I can just share a couple of things that I've heard, and that, I mean, that came up in the process of getting the getting our companion resolutions passed. But like, well, my cousin married a Black man, and and actually, and then there are like these words, these qualifier words, like, and actually he's done quite well for himself. It actually, in like those sorts of things, that's one, talking about one anecdotal experience, it's like totally unnecessary unless someone is like coming in to speak their perspective from their lived actual experience. Is just a check on it, that is probably not going to be useful to just like share some anecdotal story about somebody that that might relate to this, but is taking away what it's doing. It's taking from the real focus of whatever the discussion point is as it relates to racism, and avoiding saying the word racism or racist or white supremacy, like those still are very scary words in most spaces. So I don't know, that's what I've witnessed.
Something that I've seen some in my work, not a ton, but some, is people coming right out and saying, well, I have a Black friend and they told me that I'm not racist. And it's just not a helpful piece of the conversation to be able to hear that and not to be able to kind of dig a little deeper and unpack that piece of, your interaction with one other individual person is very different than your participation in a whole system of oppressive culture around white supremacy. So I'm sure that you're super nice to your Black friend, but that doesn't mean that you don't participate in this other kind of bigger piece of the conversation as well.
Well, and I think we can and we must center empathy and care, and calling people in, right? Rather than calling people out. And call out culture, I mean, is so pervasive on social media. I mean, it's very easy to be the keyboard warrior and, using virtue signaling and oh, I use, all the language is out there. But we have to have these conversations in real time when we can safely with COVID, right? That's also been a part of the issue that we're facing. But we can hold people accountable and do it through a caring, loving, inclusive way, because we need people to come with us, right? If we just call out everyone and you're not good enough and you're not allowed to be at this table, then who are we going to be left with? Because truth be told, everyone I know has done something and said something problematic and messed up, and we've all done it. Our culture is one that moves us forward, and we swim through these things every single day. So it is impossible to live in the world and come out of this on the other end clean. And so, I try to center my values and shared values with people when I'm feeling heated, when I'm starting to feel that inner sense. I try to understand where they're coming from, because a lot of times there's history there's context. And I also try to, find a place of agreement that we can start from, and then start to dissect like where the tactical like differences might be. And it's hard. And I think, also it's a skill that, especially again in white culture, we don't have. I think we're sharpening it again and we're getting better at it. But I was always taught, don't talk about politics and don't talk about religion. That's a pretty standard thing. And what that has done is taken us away from being able to have hard conversations. We have to move through the hard stuff to get to the other side, not around it. And, what I'm really proud of in our community is I think we're really stepping up to do some really good work.
Something that we heard yesterday is we have to hug the uncomfortable and difficult conversations, right? And I just want to say, I have learned a lot from both Amanda and Christina in that regard. So just want to thank both of them, because I think sometimes when you're in the middle of a lot of this work, it requires all of us to lend that support. And sometimes, I know Christina, you often say sometimes you're leading and sometimes you're following, right? And it's about, how can we support one another and support community in this, because it's a journey. Racism isn't something that is new. This is very historical. This is very deep-seated, and so we need to really come together around this to really, truly, and structurally eliminate and dismantle racism.
So speaking of that, so I know Brown County Board has got a declaration, 2 declarations out there. What is all happening in terms of a policy perspective? What's going on to work to address this?
Yeah, so it's great. I'm so glad that we finalized the committee members, which was like the hardest thing to do. And we've like met so many incredible people along the way, just like way more candidates or interested parties kind of wrote letters of interest than we had room for to formally sit. I mean, everybody's is invited to continue to be a part of the discussion in that space, if that's a space that, you know, folks want to get engaged with. So that was really great. So our first meeting is Monday in the auditorium at the library at 5:30 p.m., totally open to the public, but we'll be getting together for the first time. So we hope to, there's no policy, like specific policy to come out of that yet. But because this is an ad hoc committee, you know, tasked with producing an action plan, I can foresee that one of the action steps is going to be create like some sort of subcommittee or some sort of group that works with and through the Brown County Board of Supervisors, like in a permanent fashion, to work the plan. So I would foresee that being something to come out of it. But we have a lot of we've heard, like Wisconsin Counties Association is the county, like almost every county in the state is a part of it, and they in February hosted diversity, inclusion, and racial equity webinars. And so we heard from other counties that are in a similar place as us, and or 5-10 years down the road. And so we've got some great folks to be pulling on from that perspective, see what that's looked like in other communities. And then we have like incredible assets right here, like so many stakeholders who've been committed to the work for so long, that, you know, that's probably going to be instrumental in shaping what policy looks like for us. So yeah, I don't know, we'll see. But what we do know is that like the foundational part will be us like really getting to know each other, because we hope that this is like going to be a dig and working group that will have hard conversations and ask tough questions of each other and, you know, of other folks in our spheres. So, you know, that's the hope, that it's the tough stuff that you just gotta hug and lean into, because otherwise it's not gonna be substantive. It's not gonna be like real and actionable, meaningful what comes out of that, because we're gonna have to ask some really critical questions that are questioning the fundamental assumptions that a lot of the work in the county is based on. So that, like, how do you eat the whole elephant? Like that bite by bite, what Christina's saying, like it takes connecting with people in really key positions within the organization that are open, that have an openness to having the conversation, and maybe it's connecting with truths that they've already been coming to understand, and then they end up being able to do work through a racial equity and justice lens in their day-to-day. And so it ends up being contagious. And in my work in NWTC, I see how that really works, like each and every individual getting self-educated and having those opportunities, how that shifts the entire culture of a major institution. So it doesn't have to look exactly like that, but I know that that very progressive way to go about it, it can work. I've seen it here in the community.
And I mean, and honestly, Amanda, incredible work. I mean, way to come in and just hit the ground running and get, and I'm also imagining you hugging all of the other county supervisors, which kind of makes me giggle just a little bit.
Oh, I'd hug them all if I could. I'd get them real good.
But I love it. And I think the way you've approached it is incredible. And, you know, it's a step in the direction, and it'll lead to the next thing. Right. And that lift is tremendous. And what I think is interesting too, is understanding the differences in county board, city council, school board. I think like school board, I remember when we passed this resolution, I think it was like a 5-minute conversation, like, yep, we all agree. Okay, yeah, you know, the vote. But for you, different, right? I mean, just the makeup of the board and the constituency with the county as a whole. So congratulations on that work. Incredible.
Thank you. Thank you for all your support. I mean, I know that you are always there to as backup and as a sounding board, and I mean, in Natalie as well, and like the many other groups. I mean, it took all of that, and those skills that you're talking about, cultivating skills that allow us to like bring everyone along. Just it's exactly that. Like we're all at different places. I heard Natalie say that, and so if we're not all kind of moving forward from wherever our starting point is, there's not enough people who are already committed and passionate to just get it done. So we're working with what we got in the spaces that we're in. And it's a super humbling process. But early on, something that Natalie had said, not it just reminded me of this when I asked her. I'm like, this communication came up, like a different supervisor Lefebvre is like, hey, our National Counties Association made a declaration of like equating that racism is a public health crisis. I think we should look at this, and then sends it to a committee, and then it could die there. That question could go and die and just sit and get tabled and tabled and tabled. And being so new, I was like, I don't know how this works, but I'm afraid of us not having really important conversations when it just got like floated up in front of us. And I'm pretty convinced that the vast majority of the board would have appreciated just like whistling and looking the other way. So when I reached out to Natalie, I was like, this came up, and my gut tells me, even if we're not ready, even if the board isn't really, if I wasn't confident that the board was going to pass something, just like forcing the conversation by keeping that communication alive was going to be where we were at. If that's all we could do, that was really important thing to do. And if we were going to struggle in public spaces to talk about racism, then we owed the community to struggle openly, publicly, painfully, to work through that. And I think it was painful for communities of color who were listening in on some of that. And then what I felt like was a super bonus that we got it that we got it passed, because I wasn't convinced at the outset that we could. But and just as a call out to anybody listening and everyone who's going to listen in the future to the conversation here, I think that was really an important way to approach something. Like, I really truly have nothing to lose. We have so much work to do. We have to do something. Like, we can't worry about something not working out and our names being tethered to something that's not going to work out. Like, that's not a good enough reason to not do important work that's right in front of us to do. But I was so heartened and steeled by all of the wonderful people, present company included, to encourage us along through the process. So thank you all.
That's something that we talk about so much at YW, and the racial justice work that we do is that there aren't very many of those kind of moments in this work where we really like have a like good concrete win, like we did something today. So much of it is really about the process and working through and leaning into it and making better choices today than we did yesterday. And sometimes that means looking back to 6 months ago and being like, okay, so maybe that wasn't like a super great choice that I was making there. And I've got some new skills now. I've developed some things I can do better now. But really that part of just continuing to grow and learn and do better every day and keep pushing forward every day. And I'm so glad that you got that opportunity to have like that good, like concrete win. Like, we got something done here, people, to be able to move forward. Those are so important, to be able to really celebrate those wins when they come, because they do tend to be few and far between.
So I would just underscore what Amanda said, because in policy, you're often looking for that window of opportunity. right? When's the best time with the best odds that we can get something passed? And to Amanda's credit, I remember that conversation and her saying, no, we need to have this conversation. It may not work out the way we want it to, but it needs to happen. And it starts here. And you need that courageous leadership to take that stand and to say, this is important, this is a value. We need to have this conversation. It's going to get messy. It's going to be hard. But what are we doing? You know, if we're in an elected position, how are we representing the people that we're put here to serve, right? And to represent. And so I really thank Amanda for that. I think that took a lot of courage, and I think we need more and more of that. And like I said, you often wait for that right window of opportunity when you're thinking about policy, and I think that has a place, but when we're talking about issues such as racism, there's no more time to wait. It needs to happen now. We need to get to work.
And that's exactly why we need people like Amanda running for office and at the decision-making table, right? Because you come in, you know you have X amount of years to serve, and you're like, let's do this, right? Let's get this done. I'm here to do my job. And that's how I feel too. I mean, people ask me all the time, oh, what's it like to be in the assembly? Gosh, it must be so frustrating. It's like, I know I have 2 years. That's what I know. I'm gonna maximize every moment of every opportunity that's in front of me. And to your point, exactly, Amanda, what I love about it was when you said, you know, I don't know if this is going to work out, but it needs to be done, right? Because we don't do things just because we know it's going to work out in our favor. We do things because we know it's right and just. And you know, I was visiting a class at UWGB last year before COVID, and I think it was a master's level for social workers. And they were doing a reading, and the reading basically said, in the work of justice, you need to remove yourself from the belief that you're going to have a tangible outcome in your hand that you can hold and feel and know that it's due to your work. And I think it's beautiful that you have that, but at the same time, like, we have to remember that, right, the arc of justice is long. And so what we're doing is a part of a journey. It may not lead to something this month or this year, but maybe in 5 years it will tee somebody up else to pick that up, and it will be a better time or a different time, and it will be advanced in a different way. And so when I feel frustrated, like, why isn't it helping? It's like, okay, it's all part of a larger narrative, of a larger story.
So before we wrap up, is there some advice for people who are watching along of how do we get involved in this? What can we do?
Well, I'll give a couple things, and then I'll certainly am interested to hear what my friends, what their thoughts are. But, you know, here's the good news is we live in a community that is very engaged, and there's a lot of opportunity to get involved. And I tell people to, you know, just explore what is in front of you, and to be willing to try different things, and to make mistakes, and to get messy, and to, you know, go to things you're like, this isn't my thing, but maybe it'll lead to something else. So, you know, whether it's, you know, going and organizing, you know, protests or demonstrations, knocking doors, writing blogs. I mean, there's so many different ways for people to get involved nowadays. And I think it's really about getting off of social media, getting into your community, making those relationships with people, and showing up. I mean, you have to continually show up for this work. It's not just like a one and done, like, I showed up to this demonstration, great, like, you know, peace, I'm out of here. Like, it really needs to be a sustained movement. The other thing I would do is to challenge, like, you know, my colleagues in the community to spend time educating themselves, whether it's reading or listening to podcasts. But we have a lot of work to do on the back end to educate ourselves on the trauma in communities, the oppression in communities, in ways that we can understand our current reality so that we can do something about it. You know, our first task is to do no harm. And it does take a lot of intention and thoughtfulness, but people will make mistakes. And I think we have to give ourselves some forgiveness for that too.
I think I would just, all of that, just underline all of, all of that. I would say, run for office. I would say, and like, I've only been in this position for 12 months, but it took 8 people to ask me to consider this, and it just felt like this whenever my goal, I kind of knew inevitably, like, I know policy is important. It feels like my civic duty. Like, I think I've got some skills I can start with, and it'll be a big learning curve, and um, all of that, but I still didn't really understand local government or county government as well as I do now, but I didn't know it as much as you would think that I should have known it when I was throwing my hat in the ring, but I knew that um, it was important to try. Like, again, like, kind of like continuing on that theme, like, I don't know if this is going to work out, but it seems like I need to challenge the status quo, and that's who was representing me for a long time, unchallenged. And that was enough to just be like, well, I gotta try, because if we don't have choices, we don't have democracy. So that's it. Like, if you've never considered before, like, running for something or supporting someone or asking someone else, it takes many, many times, I think, for folks to be asked, for them to be able to just conceive of themselves serving community in that way. And then another thing would be throw a block party. Like, I mean, I'm just that, it sounds so hokey, but that getting to know your neighbors, I think it um, does something to us emotionally and intellectually, and reminds us that, like, people are okay, and my it's okay to interact with folks, especially like coming out of like a weird isolation period, um, because it takes exposure to what is different from our own um, experience of origin to begin to think a little bit more openly about different ethnicities, the ethnicities that are different from ours, racial differences, and all of those things. Like, many exposures help. And so, I don't know, I'm throwing a block party this summer because I want to get to know my neighbors even better than I do. So probably those two things. Just run for office and throw a block party. No big deal.
And we'll help you to run for office if anybody's watching this. There's plenty of people that will help you. So reach out to us.
Yes, there's so many. Also, in the city of Green Bay, they have a pot of money for block parties. So there.
I love it. I don't have a lot to add to those beautiful comments other than to just remind people that your voice matters. It's important. And I think that might be the one thing that I've learned through all of these advocacy efforts, is that, you know, your elected officials do want to hear from you. You may not always agree, but that reaching out and that providing your voice really, really does make a difference. It can be really hard to understand the process. So, you know, at Wello, we help people understand the process, right? As Amanda was talking about, whether it's with the racism declaration, whether it's around bicycle and pedestrian issues, it's here's how you contact the people who represent you. Don't know who represents you? Here's the map. You know, find your house. Let's find who that person is. Here's when the meetings are. And I think, so there are groups like Wello out there who will help kind of dispel some of those questions. And I know that it can be very difficult to go and put yourself out there and to share your opinion. And so sometimes what I tell people is, before you feel really passionate about a topic, maybe go watch a city council meeting, go watch a Brown County supervisors meeting, just to get a feel for what that environment looks like, so that when there is something that you really want to provide your voice to, it's not the first time you've been there, and it can make you feel a little bit more comfortable. So if there's anything, it's your voice really does matter.
That's great, Natalie. Love it. It's beautiful.
So I just want to highlight, we've got a question about resources. So I would suggest if you go to wello.org, WELLO.org, all of the work from Wello is published there, and some really, really fantastic data that's done here locally. And then also if you go to the Brown County Public Health Department, the community health assessment is up. It's there for the reading, and all of the data that was collected there through that process as well. So in terms of those resources and where to be able to find those and where to be able to sift through the data, if you want to do that yourself, those are two really fantastic places to go. So we have hit 5 o'clock. So thank you so much for being here today. Natalie, Christina, and Amanda, thank you so much for joining us and for having this conversation with us on a Friday afternoon about kind of what are we doing here and how are we moving forward. I really appreciate you so very much. And all of you out there in the universe who are watching here on Zoom or on Facebook or on the replay or wherever you may be, thank you so much for engaging in this conversation with us and sort of being a part of this process. We're so excited to be able to bring more of this into our community. And we've been really heartened to hear so many people really paying attention and being engaged with this work. So again, we've got a whole series of videos from this last year that you can certainly check out on the YW website or on the YW Facebook page to hear more about social determinants of health and different experiences. Amanda was talking about those different perspectives and experiences that people are having. We've got some really good stuff out there to look for. And there's always new and good stuff coming out. So we will look forward to seeing you again soon. So thank you again for joining us today in our mission at YW of eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. Bye, everybody.
Thank you.
Thank you.
Bye, thanks.